Hello and welcome to the ABCs of Preschool Assessment. My name is Heidi Ambrosius and I am an adapted PE specialist for the Moreno Valley Unified School District in Southern California. And I'm also an adjunct professor at the California State University, San Bernardino in their adapted PE department. So welcome. I have been an adapted PE specialist for 23 years, and 19 of those 23 years I have spent at the preschool level. I do a lot of preschool assessments every year. We do Part C to Part B transitions, so our little guys who are turning 3 that we're doing initial assessments on, and then we reevaluate all of those students that are receiving adapted PE services at their transition for kindergarten. So every year I do between maybe 75 and 85 assessments. This year it looks a little bit different because of what we're all going through with COVID, and I will talk a little bit about that as we go through this presentation. But thank you so much for joining me, and I hope you get something out of this presentation and that you stick around for question and answer afterwards. If for some reason you don't get your question answered, I do have my information provided here, my email addresses, so that you can get a hold of me. And also there will be information in the syllabus as well. So some of the issues that we deal with that are specific to preschool assessment. So when you're used to testing older kids, those kiddos might be a little bit more compliant than our younger students. They're very young and they may not be able to participate in direct standardized assessment, especially if they are delayed. So when we're looking at a child that we're testing in preschool, they are usually about 2 years, 10 months or 2 years, 11 months. So not even 3 years old yet. And a lot of them are delayed, at least a year, if not more. So that makes it difficult for them to participate in direct standardized assessment. Also, many of these kiddos aren't used to being around strange people that are asking them to do motor skills. So oftentimes we have to involve the parent in helping us to get the kiddos to do things that we would like to be able to see them to do for our assessments and also for present levels as well. So one thing that we rely heavily on during preschool assessment is parent interview. These parents know their kids the best. However, they are not trained gross motor observers. So they may know the answers to your questions, they may not. So obviously the more that we can get the students to do, the better. And some parents will have more information for you than others. It's just going to depend on that situation, what the student's needs are, and how accurate that information is that that parent can provide for you. Also, sometimes children may not want to play while you're observing them. They are in an unfamiliar environment. They don't know you. They're not familiar with the area. They may not be familiar with your equipment. They may be shy. Some of our students that have medical needs are often afraid when they come in for assessment because they don't know where they are. Are you a doctor? Are you a nurse? Are they going to get a shot and something's going to hurt? So those are all things that we have to be very cognizant of when we're doing assessments with preschoolers. Also, the other issue is that there is no gen ed setting in which to observe these students unless they are in Head Start or attending a private preschool. So unlike our students that are older and we can go observe them in their PE setting, we can't really do that with our preschoolers. So we're mainly looking at what skills they have. Are they going to meet eligibility criteria? And are they going to require service? So at this age, we have to remember, especially in the state of California, adapted PE is a service in our state. It is a direct service. So at this time, you know, they're very, very young, but it is provided as a direct service in the state of California. I know other states are different and maybe an instructional service, but adapted physical education is actually listed in California Ed Code, and our credentials in California are actually birth through 21. So we can even work with infants, which is a whole nother story, but we are direct service providers. So if you are in a district that is not serving their preschoolers with adapted physical education, that needs to be looked at because students are legally entitled to that service, just like they're entitled to their speech services, their OT services, and their PT services as well. So another thing that we look at when we're doing assessments at the preschool level is sometimes the scores are a little different at this age because a smaller gap at an older age becomes a larger gap at a younger age. So if you're testing a student that's 10, 11, 12 years old and they're a year behind, that's not that big of a gap. But when you're testing a student that's turning 3 years old and they're scoring at maybe the 18-month to 24-month age level, that's a bigger gap because there are a lot more skills in that developmental age range than there are for older students. So sometimes our tests may show them in the low average range as far as a standard score would go. I tend to go more with the age equivalents for those assessments. So what that would mean is 30% of their age level. A lot of kiddos, you know, if they're 35 months, so that's 2 years, 11 months, 30% of that age level is 24 months. So a year behind for a preschooler, again, is a bigger gap. So oftentimes with preschoolers, I do look at the standard scores, but I don't always look at just solely the standard scores. I also look at their age equivalents. What are the age levels that they're functioning at? So I included a link of preschool assessments. And so within this slide presentation, and you will get a copy of it, there is a Google Doc that has lists of different preschool assessments that you can use. I use several of them, or I have used several of them. Norm referenced assessments, one that I like to use is called the DAISY. It's the Developmental Assessment of Young Children. The biggest reason that I like this assessment is that I can give this test and get a standard score just through parent interview and observation of the student. So this student doesn't have to be able to participate in any standardized testing, like as part of, like, you know, you must stand here and I'm going to throw the ball from here. It's not that type of standardized test. So I can use this test with any of the students that I need to assess. Because again, as I mentioned before, many of our students cannot participate in that type of testing, especially at this age. We test a lot of students on the autism spectrum that can't participate in those type of tests, or just the nature of the student's disability with their delays, they can't participate in that kind of a test. So this test is great for that. Again, though, with this test, I always use the age equivalent. The occupational therapist and myself, we use this test all the time, and we're always shaking our heads because the standard scores for our students oftentimes are in the low average range. But if you look at the age equivalent, it is demonstrating that that student does have quite a significant delay and that they do need remediation in the form of adapted PE services. Also, the Brigance IED Standardized Assessment. This is a great test to use as well for preschoolers. If they can participate in the direct assessment subtests, then you can administer those. If they can't, there are 3 subtests on this assessment that can be given with parent interview and or observation. So the early gross motor skills can be purely observation. The stair climbing can be purely, early motor skills can be parent interview and observation. Stair climbing can be just observation and also parent interview. But rolling, throwing, and catching actually has to be observed. So again, there doesn't have to be direct assessment involved, but you at least need to observe the skills that you're looking for on that part of that assessment. So I'm actually giving this test virtually as well as the DAISY with my preschoolers, because within those parameters, I'm actually able to administer both of those tests. Now, with the Brigance, you will not get a composite score, because unless you're giving every single test item on that assessment, you will not get a standard score, a composite score, but you will get scaled scores. And I'll tell you, it has been helpful because I can look at the scaled scores in the early gross motor skills, the stair climbing and the rolling, throwing, and catching, and I can compare where they're at with where they fall on the DAISY and look at whether or not that student may require adapted PE services. So a couple of other standardized assessments for preschool. There's also the LAP D3 assessment, which does have some good positives about it. I really like that it separates the body movement and the object movement subtests, but those students have to be able to participate in a direct standardized assessment in order to for you to be able to complete that assessment. And the same with the Battelle. The Battelle inventory, and that's a comprehensive evaluation. Many preschool assessment teams, all the assessors use the different subtests of the Battelle, and the DAISY as well. We use a lot of the DAISY at the preschool where I teach. A lot of the service providers use the DAISY. Also, we're all very familiar with the TGMD III, and even though it is normed for 3-year-olds, I have never been able to administer it to a 3-year-old. So I do give it to 4-year-olds and 5-year-olds, especially if they're higher functioning and if they can participate in the standardized nature of it. Then usually when they're transitioning, I will give that assessment if I feel it's appropriate and if I feel that they can participate in that type of test. So some criterion referenced assessments, the CARE R2, which is Curriculum Assessment Resources and Evaluation, 2nd edition. I love this test. There are 5 subtests. There's gross motor and object control, which usually are the only ones that I give, but there is also health and fitness, perception, and perceptual motor. Some benefits of this assessment is there are a lot of items on this assessment. So you will get everything you need on a student if you give them this assessment. You'll know exactly what their present levels are and where to go, you know, to be able to write their goals. There is also a curriculum objective writing guide that comes with this assessment if you buy the entire kit. So that's another positive for this. Also, you can give this, you can use one protocol up to 6 times. So you can just keep going on that same protocol and show all the growth that that student has made. So I love revisiting the CARE R when my students are transitioning from the preschool into kindergarten, because I can show that growth and development that they've made. Look, I can show the parent, this is where they were when I first tested them, and this is where they are now. Yes, we can do that with standard scores as well, but this test has a lot of different developmental items and really shows strengths and weaknesses of where the kiddos are that we're testing. I also still utilize the Southern California Ordinal Scales of Development, the scale of gross motor abilities. It's a very old assessment, but I really like it. It is still in print, but they had to stop printing because of COVID. So I don't know if they are back up printing at this time or not. They are not available from a big publisher, only from zilprint.com. One of the things I really like about this test is that it gives you a functional age level. So based on the number of items a child gets in a certain age range, that you can determine their functional level. There's also a basal level and a ceiling level, but this is not a standardized test. So it's only developmentally looking at what skills the child has, and therefore what is their functional level based on those number of skills in that age range. The other reason I like this assessment is that it also breaks down developmental levels for strength, balance, mobility, and coordination, which is wonderful. We can show the parents, look, you know, your child is really struggling with coordination and maybe balance, but you know, their mobility is good, their strength is good, or it could be the opposite. I have a lot of students that do okay with their mobility, but their balance and coordination are lower. This test kind of allows you to show that, which is one of the reasons I love it, and I've been using it for a really long time. I also like to give this again when my students are transitioning, because it also shows growth really well, how you can see that they've moved into that next functional level. And this test can actually be given up until, I think, 7 to 12 years, where it kind of maxes out. So it's a great supplement to your standardized assessments. There's also the APEAS Preschool and the LaMap, which both are available online, that are just developmental checklists. The LaMap is interesting. It has different age levels, and it will tell you based on the score, the number of items that a child has and doesn't have, will tell you what their motor deficit is if they have one. So the percentage score will say no motor deficit, a mild motor deficit, a moderate motor deficit, or a severe motor deficit. Moderate and severe motor deficits would indicate possible need for adapted PE services. So I really like that about that test. But I don't give it all the time because I'm usually using other assessments, but it is a good one and it is available online. So just something to note. So those are some different assessments that I have kind of in my arsenal of preschool assessment. Most of the time I do use either the Brigance or the DAISY. Sometimes I actually use both of those, and then the CARE-R and the Ordinal Scales. I like to give a minimum of at least 3 assessments with my preschoolers to get a really good idea of where they're functioning. Sometimes I will select another one if I feel it's appropriate. We do also have the CALMS assessment, which is the Kunis assessment of limited mobility students. That's not a standardized test, it's a criterion test, but it's geared towards students that have mobility issues. So you can look at their motor skills specific to that assessment to see where they're at and what they need assistance with in adapted PE. Also, please keep in mind that you can never base your recommendation for special education eligibility or assessment on only one test. Please keep that in mind. That has come up recently, and it applies to special education and it applies to us. A minimum of 2 assessments need to be utilized in determining adapted physical education eligibility. Also, something to keep in mind with that is general rule of thumb for best practice would be to use a minimum of 1 standardized test and 1 criterion test, minimally. Again, if you're administering assessments and you don't feel you've gained enough information, or maybe I start doing an assessment with the kiddo and I'm like, wow, they can really participate in direct assessment, you know, and I started with the DAISY, then I may pull out my LAP D or another assessment that I know that I've seen that they are high and they can participate in that level of direct assessment. So now we're going to get into a little bit about virtual assessment and in-person assessment with our guidelines for safety right now. So adapted physical education, this references our California guidelines. Obviously, every state is going to be a little bit different, but it does talk about the different areas that we are to include in an adapted PE assessment. Some of these areas are not going to be able to be assessed in the virtual setting or until students are back on campus, and may not even be able to be assessed until we're more back to normal, so to speak, with students being able to participate in PE. So one of the things we have to look at is what we were saying before about the least restrictive environment. We can't observe students in their least restrictive environment for PE right now. So that's not as applicable to preschool as it may be for older kiddos like middle school, high school, or even elementary. But at this time, we can't do that. So that hinders our ability to make a recommendation, or it may hinder our ability to make a recommendation for adapted PE services. So this is just continued areas. And even if you're not in California, these are good things to look at from our state guidelines into what you need to make sure that you're including in your adapted PE assessments. This is some guidance, and this is kind of what I already stated about no single measure or assessment is used as the sole criterion for determining whether a pupil is an individual with exceptional needs or determining an appropriate educational program for an individual. So virtual tools, protocols, and procedures. So most standardized gross motor assessments cannot be administered virtually or even in a one-to-one COVID-19 assessment structure. And that's because you can't follow the administrative assessment protocol and follow the health guidelines. Some you may be able to, some you may not. It's really going to depend on the student, but you can't sacrifice what is required of the test and then consider that the scores are valid. Those scores are not going to be valid unless you follow the protocols of that particular assessment. So also a question that has come up, can these tests be administered by parents if I give them the proper equipment? So say you have a TGMD equipment bag that you have all set up. Well, if I give the parents that equipment in the home setting, can I coach them to administer the assessment? Absolutely not. That is not how these tests were normed. You could still do that and use that test to gather information on the student. By all means, if you can go ahead and do that, but you cannot score it and consider those standard scores valid. Again, just some tests that are in that category would be like the TGMD3, the BOT2, and the Bailey. So what we can do, okay, right now virtually we can do a lot of parent interview. We can do virtual observations. There are certain standardized assessments that can be administered through observation and parent interview. Again, preschool is an age that we can do that. For once, preschool has the upper hand here. So the DAISY-2 can be administered virtually because it can be all parent interview and observation. As I said, those 3 subtests of the Brigance IED III, and I did contact the publisher and I did receive that guidance, and they said, yes, you absolutely can administer those tests with the observation and parent interview for only those subtests. However, they did say to interpret that with caution because, again, parents aren't trained gross motor assessors. And so if you're just getting it through parent interview, it may not be completely reliable. So obviously the more observation, the better. So when doing virtual assessment, you may need to schedule more than 1 assessment observation. In fact, we should at least have a minimum of 2 observations on our reports to show that we've really made an effort to try to see what that student can and can't do. I've done that many, many times, and just getting the kid at a different time of day sometimes, they're more apt to participate more with you. And maybe you just tell the parent, like, you know, I'm going to turn off my camera so the kid can't see me, and I just want you to set your phone down and walk across the yard and play some catch with them, things like that. But just keep in mind, again, for like the Brigance only giving the 3 subtests, you're not going to get a composite score, but you will get scaled scores. For the DAISY, you can get a standard score for that assessment. You can also use standardized assessments in a non-standardized format. So we've done that before, right? With our older students, maybe they are not within the age parameters that we can administer the TGMD for it to be a valid standard score, but you can use it as a criterion test. So like I said, if you want to give, if your district is allowing you or your county to send home an equipment bag for assessment, by all means, send it home so they have some things to play with. But again, you will not be able to use it as a standardized assessment because you're not administering it as it was given when those scores were validated, okay? Some criterion reference assessments that we already talked about, the CARE-R2, Ordinal Scales, and the Brigance, and any other motor skills checklists that you might have. So one-to-one in-person assessment can be a little bit tricky. We're all excited. A lot of people can do in-person assessment now, but just because you are able to administer in-person assessment doesn't necessarily mean you're going to be able to administer standardized in-person assessment. So a lot of guidance has been still do as much as you can virtually. That way you have an idea of what the student can do. And then if they can participate with you in person, you'll be able to at least get more information, but you may not be able to administer a standardized assessment. And some of the reasons for that is that a lot of standardized assessments are going to require you to be closer than 6 feet, especially with our preschoolers. And our guidance in our county right now, we're not doing in-person assessment yet, but the guidance from our county health department is that the parent cannot be present. And that's not going to be appropriate for most of our preschool students. For most of our preschoolers, we're going to need that parent present to do different activities and different skills with their child because they don't know us. And how scary is that going to be for that 2.5-year-old that's never been away from mom, and I'm wearing my mask and my shield and asking them to do all these things. So we're having a lot of conversations about that with our preschool assessment team at this time and trying to find ways that once we are doing in-person assessment, how can we make it more beneficial so that we can maybe administer some things in person or at least observe the student in person. My hope is to do some observation with that student outside in an outside area with the parent interacting with that child with my equipment. That's my hope. We'll see if they let me do it. We have a swing area at our preschool site that would be perfect for that. So I'm kind of getting my fingers crossed, and I've been involved with the union in our district in starting to have those conversations, because that would give me a lot of information on that child and what they could do. Again, not necessarily to administer a standardized test, although again, I could do the DAISY or parts of the Brigance, but to at least have more of an idea of what that child can and can't do. Also the one-to-one in person, you know, if you have to be closer than 6 feet, that plexiglass has to be in place. Well, that's not really good for us either, because I keep telling everyone you can't throw a ball through plexiglass, right? So that's not really going to work either. So maybe with some of the older students, but not with our young preschoolers. Also, students may not be able to hear directions clearly through a mask at 6 feet away. That may be an issue for a lot of our students. And it's not really safe to leave our preschoolers by themselves in an area 6 feet away from us. So that's another issue that we have with in-person assessment. And as with virtual assessment, it may be more reliance on observation and guided skills as opposed to actual standardized assessment. And again, even with in-person assessment, that child still isn't in school. So being able to observe them in their least restrictive environment is not going to be able to happen right now. Again, not as much of an issue at the preschool level, but more of an issue for elementary, middle school, and high school. Although, of course, when I assess my preschoolers, if it's a student that is in Head Start, I will absolutely go observe them in Head Start, and I'll see how they can access their playground equipment, how they're able to utilize their motor skills, interacting with their peers. And that's not happening right now, at least in our state, because we're not in person with instruction right now. So virtual assessment reports. So you want to make sure, however you are getting your information, that you're documenting that in your report. So you want to make sure to include statements that data was gathered virtually, or if it is in person, the constraints of what that in-person assessment looked like because of the health protocols. Obviously, you're going to follow your district and or SELPA or county guidance on wording and what to include in your report. And you also need to indicate whether or not you feel there's enough information to determine eligibility, level of service, present levels, and goal development. There may be times where you are doing only a virtual assessment. Maybe you're not doing in-person assessment yet either, or even with the in-person assessment, that you just feel, you know, I just can't, until I can give this kid a real standardized test, and especially if they're high enough to participate in one, to be able to really see what they can and can't do, that you just can't make a determination on eligibility and make a recommendation. So you can indicate that in your report, that at this time, you don't feel you can make an eligibility recommendation, and that you are determining that you need to wait until that student is back in class, on campus, and also maybe in their Head Start environment, or at their preschool for their preschool environment. So just some things to consider when writing your report. So here is a QR code link to the slide presentation. You will get a copy of it in the syllabus, but I wanted you guys to have the link to it as well. If for some reason you don't get it, it will be in the syllabus, or you can always email me. So please feel free to reach out if you have any questions, any concerns. I know it was a little rushed. I only had 30 minutes. I hope you'll stick around for the Q&A. And if you can't stick around, or if for some reason your question does not get answered, please feel free to reach out and email me at either my district email address or my Cal State San Bernardino email address. I'd be happy to answer any questions, comments, concerns. I'm a huge advocate for adapted physical education services at the preschool level, and a huge believer in early intervention. I've seen it at our school for almost 20 years, that it really works. Oftentimes when I can provide these little guys adapted PE services when they're young at the preschool level, then they may not need it later on. Maybe by kindergarten, first grade, second grade, they've gained the skills that they need to be able to participate in gen ed PE environment with their peers. So early intervention works. And if you aren't servicing your preschoolers in your district, please think about doing so. Please think about sharing information with your administrators and your special education department, so that they understand the importance of it. Our students deserve to have adapted physical education at the preschool level, just like they do their speech, their OT, And there is guidance on the federal level for that as well. If you need it, I have a lot of it. Email me. That wasn't the scope of this presentation, so I don't want to spend too much time on it, but please feel free to reach out if that's the case. And any questions, comments, concerns about preschool assessment, please feel free to reach out. I really appreciate you being here today, and I'm happy to answer all of your questions.